Hello everyone. Today we'll be delivering a talk on protecting and taking care of your eyesight. So every human being has five senses, and among these the sense of vision is probably the most important sensory organ. It is often said that the eyes are the window to the soul. Various authors and poets have described the importance of eyes by phrasing vision is a window to the world. With vision, we connect with others. With vision, we feel the happiness. It is thought that 80% of our memories are determined by what we see. So, to create awareness about eye care, there is a concept of World Sight Day. And this year, the World Sight Day was celebrated on 8th of October, based on which we are celebrating this entire week as World Sight Week. It is an annual global event. The intention of this event is to draw attention on blindness and various forms of visual impairment. The objective of this celebrating the World Sight Day is to create awareness about eye care, vision blindness, and treatment in curing these various eye impairments. This day is focused on drawing attention to leading causes of blindness or visual impairment like glaucoma, refractive errors, etc. Why do we need to celebrate World Sight Day? For that, we need to understand the magnitude of blindness and visual impairment in the world. Globally, a whopping 2.2 billion people have an unaddressed vision impairment or blindness. Of these, 1 billion people have vision impairment which could have been avoided and are yet to be addressed. As per a recent survey, approximately 2% of India's population is blind, and approximately 1.1 million people are cornea blind in India. We need almost 1 lakh corneal transplants annually in India, of which only 25,000 are being carried out. So that means we need a lot more cornea donors. Before we move on to the common visual impairment, we need to know about sight and vision and the difference between the two. So basically, sight is physical. It is the sensory experience in which light reflects off an object and the eyes then focuses this light. So the signals from the eyes are then sent to the brain to be converted into images. Now, vision is how the mind or the brain interprets these images. So sight allows a person to witness an event, but vision helps him understand the significance of that event and draw interpretation. So it is of utmost importance that we protect our eyes and your sight so that we avoid any harm to them. This is a picture depicting the basic anatomy of the eyes. The black circle of the eye which we see is covered by a transparent layer called the cornea. Behind the cornea is the iris, which gives the color of the eye to most individuals. And behind the iris is the lens, the job of which is to focus the rays of light onto the light sensitive layer of the eye called the retina. And from the eye, there is a nerve arising which connects our eyes to the brain, and this nerve is called the optic nerve. So all of these important structures work in tandem so that we are able to see well. Now coming to the common eye problems, the eye problems could be different in children as compared to older children. And some of these common eye problems are refractive errors, dry eyes, digital strain, allergic conjunctivitis, color blindness, and night blindness. In children, the common eye problems are lazy eyes, strabismus, and ptosis. We will be going through each of them separately. In older people, the more common eye problems are presbyopia, cataract, glaucoma, age-related macular degeneration, and diabetic retinopathy. Again, we will be describing each of them in more detail. So, first and foremost, we come to myopia. Myopia is probably one of the most common refractive errors seen in the general public. So basically in myopia, what happens is the light rays from the object come and meet in front of the retina rather than on the retina, and this causes a blurred image. The cause of such a thing happening is usually the eyeball is longer than a normal eye length, and this causes the blurred image. It is usually seen in childhood itself, and the symptoms are blurred image, the child straining or squinting his eyes to see well, and it may also lead to headache. If detected, it can easily be corrected by giving glasses, contact lenses. After the age of 18 or 19 years, we also have the option of correcting it via a laser surgery. The second refractive error is called hyperopia or farsightedness. So in contrast with myopia, here the light rays are falling at a point which is behind the retina. And this happens because the eyeball is shorter than normal. This can happen in childhood, can even happen in adulthood. This leads to trouble reading words and needing to squint to see better. Here, the chances of having headaches is much more as compared to in myopia. Again, the treatment would be same. We need to prescribe glasses or contact lenses, and after the age of 18 years, laser vision correction is a good option. In children, amblyopia or lazy eyes is a common eye problem. Here, one eye is seeing well and the other eye is not seeing well because of numerous reasons. The poor vision eye could be having a squint, or it could be having a higher refractive error, or some other condition of the eye which is preventing that eye to see well. And if it is not detected well in time and treated well, the brain starts to ignore that eye, and the brain only receives image from the good eye. And if this continues beyond a critical age, in most cases this critical age is 8 years or 9 years, then this becomes an irreversible condition. So because of this, early routine eye examinations are very important in children so that we can detect this dreadful condition and treat whenever needed. The treatment consists of treating the cause which is causing the poor vision in that eye. So in most children, we just need to give them the correct prescription spectacles. In some cases, if the glasses are not doing the job, we need to patch the good eye so that the child is forcibly using the lazy eye, and this helps in rectification of the problem. There is no minimum age at which this condition can be diagnosed. So we can diagnose this condition in a child as young as 1 year old. So the earlier we get the first eye checkup for a child done, the better it is. Another common refractive problem that we come across in our clinical practice is astigmatism. Here, the cornea is slightly irregular, and this leads to multiple points either in front of the retina or behind the retina where the light rays meet. So this causes blurred vision, eye strain, or headaches. Once it is diagnosed, it is easily corrected by making the child wear correct prescription lenses. Contact lenses may also be used in older children or adults. Again, here too, the option of refractive surgery is applicable after the age of 18 to 19 years. Another common eye condition affecting children is squint or strabismus. So squint commonly refers to a misalignment of the eyes. So if one eye is looking straight ahead, the other eye is turned either away or towards the nose, or it might be turned up or down. It happens usually because of some problem in the brain or some muscle dysfunction, and it is commonly associated with refractive errors. Because of squint, the patient may have double vision, blurry vision, headaches, and this squint condition can also lead to development of lazy eyes or amblyopia, the condition that we saw a few slides earlier. This is another condition which needs to be diagnosed as early as possible and treated as early as possible for the best outcomes. Treatment options include making the child wear glasses, correcting the lazy eye by doing some exercises, and in some cases, surgery. The most important thing to remember here is the earlier we start the treatment, the better is the outcome. We move on to ptosis or drooping of the upper eyelid. So a few children are either born with this condition or they go on to develop this later on in the life. Apart from a cosmetic blemish, this drooping of the upper eyelid causes an obstruction in the line of vision, and this could lead to lazy eye. So again, here we need to act quickly, either by some medical treatment or by surgical treatment. We need to clear off the visual axis and restore vision and try to reverse amblyopia or lazy eyes. Moving on to infections of the eyes. So corneal ulcer is a serious and not so uncommon condition. Here there is an open sore on the cornea. In most cases, it is because of a bacterial or a viral or a fungal infection. This could be a sight-threatening condition. Hence, it is important to seek treatment early so as to prevent opacity on the cornea, which can lead to long-term visual loss. Most of these conditions are treated by eye drops or oral tablets. In a few cases, if there is opacity on the cornea, we may need to go in and change the cornea by doing a surgery. Another very common condition affecting both children and adults is conjunctivitis. So conjunctivitis basically means inflammation or swelling of the transparent layer of the eye. This layer is what lines the outer layer of the eye as well as the eyelids. This can happen either because of an infection or because of allergy. If it is because of an infection, then antibiotics or antiviral medications are usually prescribed, and this condition becomes all right within a week or two. If it is because of an allergy, it could be a long standing problem, a recurrent problem, and we may need to do something more than just medications to bring it under control. Fortunately, this is usually not a vision threatening problem, and this could be easy to treat. Now, coming on to a very common condition that affects the elderly population, that is cataract or motia bindu. That is what we call it in Hindi. Cataract happens to be the most common cause of treatable blindness. It is nothing but a clouding of the normally clear lens of the eye. So in our eye, there is a lens which focuses the light rays onto our retina. It is supposed to be clear, but as we age, the clarity reduces, and beyond a certain age, this lens becomes opaque. That is called cataract. So once our lens is opaque, then our vision becomes blur, and we start seeing as though we are seeing through a fogged up window. Some patients may also experience glare, especially in the night. There could be a faded view of colors, and as the cataract progresses, there could be a frequent change of your glass prescription. Cataract in most cases is usually an age-related problem, and most cases develop after the age of 50, 55 years. People who have diabetes, obesity, eye injury, or who are on long-term steroids may develop cataract much earlier. The best treatment of cataract is through surgery. Cataract surgery presently is the most commonly performed surgery in the world. Whenever the vision becomes blurred, clouded, or if the patient is experiencing glare, that is the time when he needs surgery. We need not wait for the cataract to ripen or become mature to carry out surgery. This is a very common misconception among people, that we need to wait for it to become fully mature so as to be able to do surgery. No, if we allow the cataract to mature fully, then we are probably pretty late, and the chances of a very good outcome reduces as the cataract becomes more and more mature. So what happens during cataract surgery? Like I said, we remove the clouded lens and replace it with a clear artificial lens. This artificial lens is called the intraocular lens, and it is positioned in exactly the same place as our natural lens, and then it becomes a permanent part of your eye. Unlike other implants like a knee implant or a hip implant, we don't need to go in and change the intraocular lens implant anytime in the life. So most centers do cataract surgery as an outpatient basis. That means you don't need to stay in a hospital after the surgery, and you can go back home as soon as the surgery is conducted. Most centers do it under local anesthesia. That means we only numb the area of the eye, either by using an injection around the eye or by using anesthetic eye drops on the eyeball. Cataract surgery is generally considered to be very safe, and the visual recovery is very rapid. most patients at our center start seeing well the very next day after surgery. We don't need to make the patient take a long rest. Most patients are able to get back to their daily routine after 5 to 7 days. Another common condition affecting the elderly population is glaucoma. Glaucoma or kala motia causes damage to the optic nerve. This happens due to buildup of high intraocular pressure within the eye. Glaucoma occurs when the eye cannot drain excess fluid within the eye, and this leads to increased pressure in the eye and irreversible damage to the nerve. This damage causes visual loss and even blindness in advanced stages. The most important thing to remember about glaucoma is that the vision loss here is irreversible. And even if we detect it and treat it, we can only look to maintain that vision. We cannot look to reverse the damage that has already been done. So that is why it becomes utmost important that we detect this condition as early as possible and start the treatment. Glaucoma is often called silent thief of sight as it has no warning signs, and most patients have no symptoms in the early stage of the disease, and it is often detected only during a routine eye checkup. Now, why does somebody get glaucoma? Unfortunately, we still do not have the exact answer, but there are certain risk factors which are thought to be predisposing one to glaucoma. One of the risk factor is age. So people who are over the age of 40 years are more likely to develop this condition. People who have glaucoma in their family members. For example, if somebody's parents had glaucoma or somebody's brothers or sisters have glaucoma, they are more likely to develop it. Then certain systemic conditions such as diabetes, heart disease, high blood pressure are additional risk factors for developing glaucoma. Eye injuries or certain type of eye surgeries again could be risk factors for developing glaucoma. Certain medications such as steroids, especially steroid eye drops used over a long period of time can lead to glaucoma. If a diagnosis is made in its early stages and treatment is started appropriately, vision loss can be slowed down or prevented. So during your eye checkup, we will be checking your eye pressure. We will be checking the passage of your eye through the fluid, through which the fluid drains. We will be checking how much damage has happened to your nerve by doing a perimetry and OCT check. We would also be checking the thickness of your cornea so as to help us formulate the best treatment plan for you. Presently, we treat glaucoma by lowering your eye pressure, and this is done by using eye drops, tablets, laser treatment, or in some cases, surgery. Another common condition affecting the elderlies is age-related macular degeneration. This is a condition where loss of central vision is seen. And this is the fourth most common cause of blindness worldwide. If somebody suffers from age-related macular degeneration, they find it hard to recognize faces, drive, read, or perform other activities of daily life. The risk of this condition developing increases as the age increases. Broadly, there are two categories of age-related macular degeneration. There is a dry form and there is a wet form. The dry form is slightly less harmful as it is a slow progressive condition. The wet form is thought to be a more aggressive and more dangerous form of this disease. If somebody is been diagnosed as having this condition, we typically do some imaging of the retina. We take photographs, we do a scan called as OCT scan, and that helps us to determine what would be the best treatment for you. Diabetes is becoming more and more common in our country, and with that, diabetic retinopathy, that means affection of the retina of the eyes due to diabetes, is becoming common as well. At first, diabetic retinopathy may cause no symptoms or only mild vision problems, and patients are more likely to ignore it at this stage. But if it is allowed to progress, then it can lead to severe and irreversible visual loss. The longer somebody has diabetes, the more chances of him developing this condition. The lesser the diabetes control, more chances of him developing this condition. So what happens if somebody develops this condition? There could be spots which are not visible to the patient. The patient may have blurred vision or fluctuating vision. By fluctuating vision, I mean whenever the sugar rises, the blood sugar rises, the vision might become blurred. And as the sugar comes back to the normal level, the vision might become all right. So if somebody has fluctuating vision, we think of this condition. Apart from diabetes, if somebody has uncontrolled blood pressure, high cholesterol, these conditions can predispose to one developing diabetic retinopathy. Coming to eye strain, this is one condition which affects children and adults alike. Although eye strain can be uncomfortable, fortunately it does not lead to any permanent eye damage. In our urban lifestyle, the most common cause of eye strain is extended computer usage or usage of other electronic devices such as mobile phone, tablets. Usually it goes away once you take a break from your computer usage or you go on a vacation or if you take regular breaks while using computer screens. What could be the symptoms of eye strain? Most patients develop blurred vision, irritation in the eye, burning sensation, watering, redness, intense headache, feeling of disorientation, and difficulty in focusing. Currently, because of the COVID-19 pandemic, there is an increased usage of digital devices. Children are doing their online classes on computers and mobile phones. People are working from home on their computer and mobile phones. And because of this, the incidence or prevalence of digital eye strain has increased tremendously. Apart from computer screen, there is also increased watching of television, watching of videos on mobile phones, chatting over social networks, and using social media. All of these are contributing to increased prevalence of digital eye strain. So eye strain can eventually lead to difficulty in reading, difficulty in shopping for groceries, difficulty in cleaning and dusting, and this can have an adverse effect on our daily life. So, unfortunately, usage of computers and mobile phone has become a part and parcel of our modern lifestyle, and it is very difficult to totally stop them. But if we follow these healthy eye tips, probably we will be able to keep ourselves away from this condition. The first eye tip: keep your device at least 25 inches away from your eyes. Try to lower the brightness of the screen. Please remember that the computer screen or the mobile screen is a source of light. There are LED bulbs in the screen and you're looking at a source of light, and if you continue looking at a bright source of light, that is going to harm your eyes in the long run. So try to lower the brightness of the screen. Follow the 20-20-20 rule. So this rule says that after every 20 minutes of work on the computer or digital screen, you need to take a break for 20 seconds, and during that break you need to look away at an object which is at least 20 feet away. You need to wash your eyes twice or thrice in a day. We recommend using filtered water so as to prevent chances of infection. Try to restrict usage of electronic screens during the night time so as to reduce the chances of sleep disturbances. If you have the option of working on a laptop or a mobile phone, always go for working on the laptop or desktop, because bigger the screen, the lesser the strain on the eyes. Whenever we look at a computer screen, we forget to blink. So consciously, we should try to blink more while we're looking at the computer monitor. Another very important thing is we need to do regular eye checkups. Like we discussed before, there are so many conditions which do not cause any symptoms or problems in their early stages. And these conditions can be detected only during a regular eye checkup. The regular eye checkup not only includes testing your vision and your glasses power, but it also includes testing your eye pressure, testing your retina, testing your optic nerve, which would only be possible with an eye doctor. Like we noted in the first few slides, that we need more and more people to donate their corneas. This would be a good opportunity to take a pledge to donate our eyes after our death, so that it helps somebody and our eyes continue to see the world even after we are gone. So in case if you wish to pledge your eyes for donation, you could visit the EBAI website to know more. So I thank you all for patient listening. Thank you. Thank you very much. Hello.
Yeah, Rahul.
Hello.
Yes, sir.
Hi, Sachin.
Yes, sir. Nice presentation. Nice talk.
Oh, thank you. Thank you.
So we'll send you link as soon as possible by
Sure.
tomorrow morning.